This is Module 4, discussion question on subdural hematomas. Subdural hematoma is a condition where there's a collection of blood in the subdural space. When a surface vein is torn around the cerebral cortex, it can cause a subdural hematoma. There are 3 types. There's acute, which happens within 48 hours of the injury. There is subacute, which happens 48 hours to 2 weeks after the injury. And there is chronic, which happens when there is low velocity impact and occurs 2 weeks to months after the injury. The way to recognize cues with subdural hematoma is to assess the patient. We want to look at the signs and symptoms, do a neurological examination, the Glasgow Coma Scale, check their airway and oxygen status, cerebral blood flow status. We'll also look at intracranial pressure, CPP, and hemodynamic monitoring. Patient history that could be pertinent is in the elderly. Many elderly people have falls, which is very common. Also chronic alcohol abusers and those patients who are on anticoagulants such as warfarin or antiplatelets or aspirin. Some of the priorities that we should be utilizing is we want to take a look at the head injury, look at the dysphagia. We'd want to do a dysphagia screening because some patients can be potential for aspiration. They may have a fever, a headache. There could be some fluid imbalances, altered functional ability, and communication barriers are signs. The interventions that are available for a subdermal hematoma include medical interventions, which is to reduce the intracranial pressure. We want to make sure the patient has a patent airway and is receiving oxygen. We want to ensure that there is cerebral perfusion, and we want to prevent a secondary TBI. When a patient has a TBI or subdural hematoma, it can deplete their stored energy and muscle mass. So we want to make sure we're providing nutritional support. And then, of course, there's surgical interventions, which is evacuation of the hematoma with burr holes. We want to make sure that we're implementing goals that are attainable. So what we want to do is definitely avoid nutrition deficits because we all know nutrition helps the body heal. We want to maintain their airway and oxygen saturation, give them postoperative care, provide fluids to prevent electrolyte imbalances, and of course we want to prevent infection, so we need to take a look at signs and symptoms of infection. It's always good to try to ambulate your patient early, as soon as possible, to get the body moving and make sure to administer any medications as they are prescribed by the physician. We always want to make sure to evaluate the outcomes, so we need to reassess our patient. The treatment goals that we've set, we need to make sure that the patients are meeting those goals. So again, infection, we want to make sure the patient is not getting an infection from any surgical treatment. Keep their fluid balance intact and make sure their oxygen levels are within normal limits, above 92%. Make sure they also have a patent airway, and of course we want to make sure our patient has pain relief. The references that I used is from the Introduction to Critical Care Nursing book for our class, and that is the end of my recording.